I'm Dr. Jimmy Hu. I'm a cataract, corneal, and refractive surgery specialist. I graduated from the University of Pennsylvania, and then I went to Albert Einstein College of Medicine for med school. Afterwards, I did an intern year over at Brown University, and then I trained over at Montefiore Medical Center for residency. And afterwards, I did a fellowship in corneal and external diseases and refractive surgery over at the Wilmer Eye Institute at Johns Hopkins University. So as you can imagine, that's a lot of years of school. The Wilmer Eye Institute at Johns Hopkins is actually where I credit most of my surgical training and experience from. And it's because I train with a bunch of people there who are very, very passionate about what they do. And it's an environment where afterwards you leave that place sort of becoming the kind of personality that ends up thinking about eye surgery while you're in the checkout line at the grocery store. Philosophically, I believe that surgery should be boring. And I say this as someone who loves surgery, but philosophically, surgery to me should be boring. And it's because when it's boring, it means that everything's going according to plan. But how do you ensure that everything goes according to plan? Well, in general, if I have a tough corneal transplant surgery or something along those lines coming up, it's because by the time I walk into the operating room, I already have plan A, B, C, D in my head already worked out. So if something happens with plan A, we switch to plan B, and then plan C, and so forth. Before your surgery, there's a couple steps that we want you to take in order to get you the best outcome possible. The first is that because 100% people have dry eyes after surgery, we want you to get in the habit of using eye drops. So when it comes to eye drops, keep your eyes as moist as possible, and this is even before you even have laser vision correction surgery done. In terms of putting in those eye drops, the easiest thing to do is to look up at the ceiling, take your hand, hold down the lower eyelid to form a little pocket there on your eye, and then just put the drop in that pocket, and then snap back and release. That helps, and as you blink, that disperses the medication over the surface of your eye. If you have a hard time doing that, the other thing you can do is lay down on a flat surface like a sofa or a bed or a couch, and then just put the eye drop in that corner right there between your eye and your nose, right over here. And then once you have the drop in that space, just roll a little to the side. And as you do so, that medication should go into the eye itself. Other things to do prior to surgery, again, we want you to be out of contact lenses for 2 weeks prior to the laser vision correction procedure. And why is because contact lenses act like little suction cups on the surface of your eye. So just like suction cups on your skin might leave a little bit of an indentation once they're removed, so too can contact lenses do so on the surface of your eye. And since we care very deeply about precision and accuracy, when you shoot for the moon, every half degree matters. And so we want your eyes to be in a state that's representative of what they're going to be like long-term without contact lenses there. We do the laser vision correction procedure over at our Laser Eye Center, which is not where our main clinic is located. Instead, it's over at Palisades Park, and our coordinator will give you all that information. When you come in for surgery that morning, again, make sure that you've eaten something, bring a little bit of water with you. Our staff will greet you at the entrance. They'll guide you to the waiting area, and our coordinator will go over, again, some of the instructions with you. You don't need to fast or take any special or different medications prior to your laser vision correction procedure. Whatever you're doing normally, keep doing that on the morning of your procedure. So if you take any medications in the morning, just take those same medications on the morning of your LASIK procedure. Just make sure you don't come on an empty stomach. Make sure you have a bite to eat in the morning. So if you're nervous before the procedure, or if you feel a little claustrophobic, we give you Valium, which is a medication to help you relax. You feel a little bit woozy, but you're still awake during the procedure, and it's because we need you to be awake enough to look at the blinking light in front of you during the actual procedure itself. After the laser vision correction procedure, your eyes are going to be blurry, light sensitive. It might be a little smoky, foggy, and hazy, and it's going to feel scratchy and uncomfortable. Ultimately, it's going to feel like your eye's been cut by a laser because it's been cut by a laser. We're going to examine your eyes immediately after the procedure at the microscope, and then we'll send you home. And when you do get home, go ahead and take a nap. That nap helps ensure that your eyes heal nicely and properly after the after the laser vision correction procedure. It also helps a lot with the light sensitivity. When you wake up from that nap, go ahead and put in the first set of eye drops. After the procedure is done, we give you a pair of sunglasses to put on, and it's because everybody is light sensitive. Ultimately, if you want to wear your own sunglasses, that's totally fine. All I care about is that you have wraparound sunglasses. And it's because we don't want any sand, dirt, or dust getting into your eye on your way home from the surgery center. When you do get home, we've got an eye shield for you to wear. And it's because I trust you not to rub your eyes after the procedure. We don't know what happens at night. It's much like a pair of swimming goggles. You're going to put it on, and then there's a strap on the side that you can use to tighten. And again, the idea here is that if you roll your face into the pillow, there's at least this physical barrier that's meant to help protect your eyes. This you do not need to wear during the day while you're at home or even out and about. You just need to wear it at nighttime. And again, it's because I trust you not to rub your eyes while you're awake. We don't know what happens at night. After the procedure, you can shower, you can wash your face, but when you do so, be careful about putting any kind of pressure on the eyeball or the eyelid. So in the shower, let the water run down your face with your eyes closed, and then afterwards, use a towel and pat dry your face. Let the area around your eyes just air dry. And again, the idea here is we're trying to prevent you from accidentally putting any kind of pressure on the eyeball or the eyelid. After the procedure, by the same token, please refrain from wearing any kind of eyeliner or mascara or makeup close to the eyes for about 2 weeks. And why is because as part of that process, when you remove that makeup, you do need to rub your eyes pretty aggressively in order to remove the makeup. And again, we're trying to prevent you from putting any unnecessary pressure on the eye. When you're washing your face, it's okay if water gets into your eye. It's okay even if a little bit of soap gets into your eye. That's not the big concern. It's pressure that gets into the eye. If a little bit of water or soap gets in the eye, just by all means afterwards, go ahead and use an eye drop that will displace any chemical that's there. You can certainly take Advil or melatonin after the procedure. If you have any pain or discomfort, by all means, take some Tylenol or ibuprofen. That's totally fine. Go home and take that nap. If you need to take some melatonin to help you sleep, by all means do so. After the procedure, please wait 1 week before doing any strenuous physical exercise or any heavy physical activity. That includes going to the gym, lifting heavy weights, gymnastics, sports, what have you. Please wait 1 week. And why? It's because you've had eye surgery. There's a wound on the surface of your eye. And while it's not a very large wound, if you put a lot of pressure on your body, if you squeeze, if you heave and lean forward and bend over and try and lift something really, really heavy, that might cause some pressure, or that might cause you to squeeze and put some pressure on the eyeball itself. So we typically see you 1 day after the laser vision correction procedure, and then 1 week after the laser vision correction procedure. Afterwards, we also see you about a month or more, and this is largely just to make sure that everything else is healing fine. If anything, that's considered an optional visit. But 1 day and 1 week after the laser vision correction procedure, we want to see you in the office just to make sure that everything's healing up nicely and that you're not having any issues putting in eye drops or using the eye shield or anything along those lines. So after the procedure, we give you a bottle of eye drops to use, and this contains the medications that you're going to use after the surgery. For LASIK, you're using these eye drops 4 times a day for a week. It doesn't matter when exactly you're using those eye drops, as long as they're evenly spread throughout the day. So if you're using it 4 times a day, I find the easiest schedule to keep is with breakfast, lunch, dinner, and right before bed. But if you have a different system, that works too. Whatever you're able to consistently do is fine by me. With PRK, you're going to be using a bottle of eye drops 4 times a day for a week, then 3 times a day for a week, then twice a day for a week, and then once a day for a week, and then finally you stop. So after laser vision correction, your eyes are going to feel very dry. This is normal and this is expected. Your vision might fluctuate. Even though you don't feel any pain or dryness, you might not necessarily feel that your eyes are dry, but you'll see that your eyes are dry. And by that I mean you'll look at something, it'll be mostly clear, but after staring at it for 10 minutes, it might get a little bit blurry and out of focus. you'll pause, you'll take a step back, you'll blink a couple times, it'll get clear again, and then 5 minutes later, it'll be a little blurry and out of focus. And that's very classic for post-LASIK or post-PRK dryness. This is normal, this is expected, this gets better over time, but you can certainly help that process by using artificial tears to keep your eyes moist. With LASIK, your vision is mostly clear after 24 hours. It's not perfectly clear, and that continues to improve over the course of a week. With PRK, it's a little bit slower because your vision is mostly clear on the first day, and then it gets a little bit worse between 3 to 5 days, and then it gets better again around 5 to 7 days. At that point, once the contact lens comes off, your vision is, again, mostly clear, but it's not perfectly clear, and you have small fluctuations for about a month afterwards. This is normal and this is expected, and then finally it stabilizes. So after PRK, you're going to have a bandaged contact lens placed on your eyes. This is a clear contact lens with no prescription in it, and it's meant to act like a shield to help protect the surface of your eye while new skin grows underneath. This takes over the course of about 5 to 7 days, and during this time your vision will fluctuate a lot. The first day after PRK, your vision is going to be mostly clear. Not perfectly clear, but mostly clear. And then paradoxically, it gets a little bit worse before it gets better. And that has everything to do with the healing and recovery process. As the skin on the surface of your eye comes towards the center, it forms folds and you see distortions in your vision somewhere around the 3 to 5 day mark. And then after that, the skin seals down and forms one smooth surface, and that happens around the 5 to 7 day mark, at which point it gets clear again. So after PRK, you have a bandaged contact lens placed in your eye. This is a clear contact lens with no prescription in it. It's meant to act as a protective surface over your eye while the skin on your eye heals and recovers. You do not touch this contact lens. We leave it in your eye for a full week and we remove it in the office. So don't touch it yourself. Don't try and remove it yourself. If it does, for whatever reason, fall out of your eye, please call the office and we will deal with that. Do not try and put it back in. If the contact lens is really uncomfortable in your eye, please give us a phone call. After laser vision correction, your eyes are going to feel dry, and this will last for up to 6 months after the procedure. Again, this is normal, this is expected. This gets better over time, but during the first month, your eyes will feel very dry. It's going to feel like you're putting in wetting drops all the time, every hour, 2 hours. And in general, the more moist you can keep your eyes after the procedure, the better and the faster your recovery is going to be. So especially during the first month after LASIK or PRK, it's a lot of artificial tears. Again, this is normal, this is expected, this is a good thing. If you have any questions or concerns, please reach out to either me or our surgical coordinator or our staff. We are more than happy to help you.